So now I'd like to transition into the other extremely important part of this, which is the physical therapy. My wife is a physical therapist by training, so I say it affectionately. PT does not just stand for physical therapy. Sometimes it can feel like pain and torture or physical terrorism. But it's critically important, and having people that have experience, dealing with people that are having pain and getting through this process is vital. And again, St. Anna Tustin Physical Therapy is, one of the local stars in this regard. What we have is getting patients. It used to be that patients were in bed in the hospital, when this joint replacement first started, for 2 or 3 weeks in the hospital. Then it transitioned down to a matter of about a week. And now it's more about 2 or 3 days. But what is newer with these new blocks is being able, once the spinal anesthesia wears off, the day of surgery, to get people up and walking early, and having patients show them that their knee bends when they're under a block so that they know what they can do. And then getting that to be, multiple times a day in the first few days. We like to get physical therapy coordinated at home ahead of time. And traditionally, home physical therapy is 3 times a week for the first 3 to 4 weeks. But we, working with local agencies, we can get that so that they're getting physical therapy in that first, second, and third day when they're home. And then the other thing that's changed is it used to be a burden, and it still is to some degree, about getting your dressing, your incision changed. And the trend is to actually not change it routinely every 2 or 3 days, but because the infection risk is lower, to actually change it as infrequently as you need to. Unless a bandage is totally saturated with blood, we're cutting back on how often we need the support to have a dressing changed at home. As I alluded to earlier, it's critically important when you're starting to talk to patients about this, if you give them the heads up that, hey, you really need to have somebody help you prepare meals for that first week, checking in on you. It's very commonly the case that even people that are single or widowed or don't have much help, that you can find help, and that is far preferable to going to a skilled nursing care where the care is not just spotty and very expensive, but where you're at a much higher risk for getting an infection. And the last place I would want to go or have my family go is to a skilled nursing care facility that's colonized with all kinds of resistant staph bacteria. That really should be a last resort, and that's what we need to be thinking of and educating our patients about before they have the surgery done.